I should have the same opportunity to lead a healthy life in the UK, no matter who I am or where I live. Respected judges and the distinguished audience, a very warm welcome to you all. My topic today is health inequalities in the UK. Of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. The words of Martin Luther King. What are health inequalities? Well, they are the systematic, avoidable and unfair differences in health between groups of people. Health inequality is unfair and is often triggered by the system. The NHS are the real heroes in maintaining the health system in the UK. But why do we have fewer GPs in some parts of the UK? Why do people in some parts need to wait for years to get hospital treatment? It is unfair and avoidable. Can this be controlled at a national level to give everyone the same level of service? It is a real concern when the King's Fund UK studies reveal the people in the most deprived areas in the UK live up to 19 years less in good health. How do we measure health inequality? The foremost measure is life expectancy. As per the reports from the Office for National Statistics UK, the life expectancy in the southeast of England is 81 years, whereas in Scotland it is only 77. This clearly shows the extent of health inequalities in the UK. What causes health inequalities in the UK? Well, these include socioeconomic and behavioural factors. Socioeconomic factors include income, education, occupation, ethnicity, disabilities, housing, social care, and so on. Behavioural factors include smoking, poor diet, physical inactivity, high alcohol consumption, as identified by the Public Health England's 2020 to 25 strategy. These socioeconomic and behavioural factors are mutually reinforcing and drives inequalities in both physical and mental health. Are inequalities getting better in the UK? No, it's not. The UK Government Health Inequalities Dashboard of March 2021 reports that it has increased significantly over the last 10 years. The COVID-19 pandemic has widened this gap even more and starkly exposed the health inequality across different races, gender and geography in the UK. The Department of Health UK and NHS has been taking positive steps and have passed legislation such as the Equality Act to reduce the health inequality gap. However, the King's Fund UK report suggests the traditional healthcare sector interventions alone are not sufficient enough. It requires a collective effort from various departments to effectively control this. Needless to say, the onus of preventing health inequality is not just on the government. NGOs and individuals are equally responsible. The events organised by UKMA during the COVID-19 pandemic to support mental health of affected communities is an example. See the remarkable services of our Malayali nurses bringing the number of COVID deaths down. I am also privileged to say I was part of a charity fundraising event this year to support families affected by RTS, a rare congenital syndrome. We need healthy children, healthy minds, healthy places, healthy communities and healthy living for all, evenly distributed across the UK. See the initiatives of famous footballer Marcus Rashford. The campaigning initiated for free school meals in the UK helped 1.3 million children during the summer holidays. Take inspiration from the Every Mind Matters campaign run by the Duke and Duchess of Cambridge to support mental health. See the initiatives from the UN Climate Change Conference, COP26, hosted in Glasgow, UK, on the need for healthy green spaces. All these initiatives help reduce the health inequality gap in the UK. It is the responsibility of everyone to be a part in the efforts to reduce health inequalities. I will finish my words with the famous quote of Gandhiji. It is health that is real wealth, not pieces of gold or silver. Thank you.
What is a health inequality? A health inequality is an avoidable, unfair, systematic difference in health and can be experienced across different groups of people. The World Health Organization further states that it has both social and economic impacts and can be reduced by the right mix of government policies. Health inequalities can be experienced across different groups of people and are analysed across 4 major categories. These are socioeconomic, relating to income, geography, relating to region, characteristics, for example, ethnicity and sexuality, and socially excluded groups, for example, asylum seekers and homeless people. The UK's Office for National Statistics states that the average age of death in the UK is from the early to mid-80s. However, that number drops to 59 for people with learning disabilities and 44 for homeless people. Regarding mental health, asylum seekers are 61% more likely to experience severe mental health issues, which is 5 times more than the general public. And 71% of the LGBTQ plus community experience depression, compared to around 20% in the general population. Regarding homeless people, it is much harder for them to access the services for health and social that they require. This is often because the services are separate and disconnected, and they're often difficult to navigate and use. Many homeless people are vulnerable adults with complex mental health issues and or suffer from substance abuse. Many of them also have physical issues, which are often compounded by living on the streets. However, many of them cannot access the services that they require in order to get better. A report done by Public Health England South East states that most of the homelessness found was in big urban tourist areas. Cities with major problems include Brighton and Hove, Canterbury, Oxford and Maidstone. So how can we stop this? Well, I'm going to share with you 4 strategies on what I think can help reduce health inequalities. The first is to increase the minimum wage and increase and better working conditions. This will mean that people with lower income can earn more money whilst improving their mental health. The next strategy I'm going to share with you today is to have more health professionals in deprived areas. This means that there will be less people per doctor, meaning that there can be more healthcare services. The third strategy I'm going to share with you today is to use education for the public to understand what is happening. And the final strategy I'm going to share with you today is for more stricter laws in place for abuse against people of other ethnicities and sexualities. This will improve their mental health well-being, making sure that we have less health inequalities. So what do you think? What can we do against health inequalities? What strategy would be best suited? Is it some of them? Is it all of them? Or do you have any other strategies? What do you think? What can we do against health inequalities? Thank you.
Good morning all. Health inequalities are unjust yet avoidable differences between communities and groups of people. Today, we will discuss what they are. When talking about health inequalities, we must talk about life expectancy. Inequalities in life expectancy are the foremost reason for health inequalities. Life expectancy is heavily related to people's socioeconomic circumstances, and the word used to summarise such circumstances is deprivation. The index of deprivation is a way to summarise how deprived people are within a certain area. The social gradient of health is the systematic relationship between deprivation and life expectancy. Males in the least deprived areas are expected to live roughly 9.4 years longer than those in the most deprived areas, and the gap for females is 7.4 years. It's worth noting that not everyone experienced these. Everyone over the population has to deal with this gradient, not just those at the very bottom, at the very top. There are also geographical inequalities in life expectancy. For example, the north of England has a higher concentration of deprived neighbourhoods, therefore making the overall life expectancy rate lower than the south. We should also mention mortality. Avoidable mortality rate, to be more specific. Some deaths are avoidable with the correct preventions, measures, and healthcare at a certain time. The difference of avoidable deaths between places is also reflecting how easy it is for people to get the help that they need for issues like life-threatening risks or illnesses. Males in the most deprived areas are roughly 4.5 times more likely to die from avoidable causes than those in the least deprived areas, and females in the most deprived areas are roughly 3.9 times more likely to die from avoidable causes. We must also talk about long-term health conditions. Long-term health conditions are very, very important to this topic. Long-term health conditions are a major key as well. In 2017 in England, more than 50% of people with long-term conditions saw their health as a barrier for the amount of work that they could do. And this statistic rose to 80% when talking about people with 3 or more conditions. People in the lower socioeconomic groups are more likely to grow a health condition. It is also worth noting that deprivation also affects your likelihood of gaining multiple of these, meaning that people in the most deprived fifth of the population gain multiple health conditions almost 10 years earlier than those in the least deprived. In conclusion, I would like to say that that is all that we could talk about for now. There are many more topics we could talk about. However, we do need to do something about it. As a community, there are things that we can do, and while we may not have covered them here, you can find them out for yourself. It is our duty to stand against these inequalities. Thank you.
Here are my thoughts on the health inequalities in the UK. Back in February last year, I fractured my elbow. And it was torture, not only because of the pain, but I couldn't write, couldn't play badminton, and worst of all, I had to sit in A&E for what felt like days until I was finally examined and given a sling. And if you've ever been to A&E, you know that they operate in a completely different time zone. Now, for me, that was an inconvenience. But for someone else, that time could have meant the difference between life and death. That person may have needed specialist treatment that wasn't available in their area, or they might have needed urgent care because they didn't have access to vital medication. And this, ladies and gentlemen, is a widespread issue across the entirety of the UK, and it is described by the term health inequalities. Health inequalities is a broad term that encapsulates how the accessibility and quality of healthcare, behavioural risks to health, and environmental risks to health systematically and unfairly differ between various demographics in the UK. Now, the topic of health inequalities has been in discussion for a long time, but COVID-19 was the tipping point for the entire population. The deprivation gap became almost twice as large, meaning that it disproportionately affected those already experiencing inequalities and for the first time in 20 years, the average life expectancy fell in the UK. And throughout my research, I found countless graphs with information about the northeast-southwest divide, but the true causes of health inequalities cannot simply be illustrated on a coloured map. There are professions such as cleaners, plumbers, and distribution drivers, or those who work 0-hour contracts, who generally receive a lower and less steady income than, say, doctors, lawyers, or chief executives. Now, while this pay gap is a whole speech in itself, the result is that if you have a lower socioeconomic status, your top priorities are to pay the bills and to put food on the table. And sadly, the cost of prescriptions or the transport costs involved with getting to the nearest clinician are simply too financially damaging for certain people. And this isn't based on psychological estimating, but rather on fact, as a study done by the King's Fund found that socioeconomically deprived individuals are over 4 times more likely to take risks with their health. And 4 seems to be an unlucky number in this topic, as a recent study done by the British Medical Journal found that black women were over 4 times more likely to die during pregnancy or childbirth. Their research showed that for every 100,000 women who gave birth, 34 black women died, compared to 15 Asian women and 8 white women. This disparity in maternal deaths is due to a systemic bias towards race, which is striking but unsurprising. But many health inequalities are also caused or affected by the inherent nature of the healthcare system. As the population steadily increases, the demand for services has also been rising due to an increase in admissions, referrals, and outpatient attendances, putting significant pressure on the NHS. This has resulted in access to treatments becoming extremely limited, and in the southwest of England alone, there is a shortage of around 12,000 GPs, which means doctors are being forced to work longer hours and see more patients than they should, which results in a decrease in the quality of the healthcare provided and further worsens these health inequalities. In conclusion, health inequalities are caused by a variety of social, economical, geographical, and demographical factors, all of which are experienced in different combination. But there are modifiable risk factors which we have the power to address by eating less processed foods, exercising well, getting adequate sleep, and keeping smoking and drinking alcohol within sensible limits. But the main solution for these health inequalities lies in population health management, which is a crucial part of the healthcare system's response and recovery, that helps to create beneficial models and proactive, integrated ways to deploy the necessary facilities in any given area. And only until this is implemented nationwide can we have the assurance that we are safe in our country. Thank you very much.
Today I'm going to be talking about health inequalities in the UK. And I'm going to be starting with a poem by Bertolt Brecht, and it's called A Worker's Speech to a Doctor. It goes like this. We know what makes us ill. When we are ill, we are told that it's you who will heal us. When we come to you, our rags are torn off us and you listen all over our naked body. But as to the cause of our illness, one glance at our rags could tell you more. It's the same cause that wears both our bodies and our clothes. What a poignant piece of poetry. It's such a deep reflection of how adversely poverty, low income, or deprivation can affect the quality of healthcare that one receives. And it's such a shame that years later the situation is just as grim. So what even is health inequality? Well, it's the unfair but unavoidable differences that exist in the status of health between different groups and communities. The average age of death of a typical British male or female is around 84 years. Guess what that age reduces to if it's someone with learning difficulties? It's just under 60 years. And if you're homeless, that age reduces to an average of 44 years. There's a stark difference in life expectancy based on who you are and where you come from. And in a developed country like England, this should not have to be the case. But to be able to target these health inequalities, we must take a deep look at the causes of these vast differences. There are four main factors: socioeconomic, which is based on income; geographical factors, which is based on where you live; specific characteristics such as ethnicity or sexuality, which may mean that you are more prone to developing certain diseases; or whether you belong to a socially excluded group, such as homeless or asylum seekers. Depending on these factors, there could be limited access or poorer quality of healthcare, or some of the everyday practices of people belonging to more deprived groups could mean that you are at greater risk of developing certain health issues, such as if you drink or if you smoke. But you must understand that these factors are based on an even wider range of determinants, such as housing, environment, job opportunities, education, or even transport. And the list goes on. But to be able to handle these health inequalities, we must understand the complex interactions between all these factors, which can often seem like a vicious circle. COVID-19 has had a devastating effect on exposing and exacerbating pre-existing health inequalities. For example, people younger than 65, the mortality rate of those people who belong to more deprived groups is 4 times higher than the mortality rate of people belonging to more privileged groups. And the gap in the number of years that people can expect to live in good health between the rich and the poor has widened like never before. But thankfully, because of all this, there has been an increased focus on health inequality by NHS leaders and by governments. And the NHS has been asked to take forward urgent action and to increase the pace and scale of provision of healthcare in order to bridge these gaps. The government has upheld an ambition to increase life expectancy in the UK by 5 years by 2035. Health Minister Sajid Javid has said that the country will only level up economically if we level up in terms of healthcare too. The Health and Care Bill, published in July 2021, has offered a potential route to strengthen action in reducing health inequalities. Under this plan, NHS rules and structures have been modified to comprise of integrated care systems, which target each local population group to provide the best possible healthcare. These NHS bodies will be governed by the government so that they can assess and re-evaluate the improvements made. Hopefully, we will see a better future where your economic situation and your background no longer dictates your good health. And we must all resolutely remember that any country's greatest asset are healthy citizens. And while the government does their job, every citizen must also remember to give back to society, and to uplift others wherever they can. Let's all work together in order to bridge these gaps and make Great Britain even greater. Thank you very much.
I'm going to start with a story. So, the most important woman in my life, of course, my mother, works in the health sector as a nurse practitioner. Almost every day she comes home with these fascinating stories about the events that occurred during her day. So, one day she comes home and she says, I spoke to these two patients today who lived in different counties but had a similar sort of disease. One was able to see a doctor straight away, whereas the other one struggled to even see one. This is called health inequality. By definition, health inequalities are unjust and unavoidable differences in people's health across the population and in specific population groups. They do not occur randomly or by chance. So, if it's not random, then how? And why does health inequality exist? Many factors contribute to health disparities, including genetics, access to care, poor quality of care, community features such as inadequate access to healthy foods, poverty and violence, lifestyle, and environmental conditions such as air pollution. Currently in the UK there are 248 hospitals and 2,220 GPs which are in areas of high pollution, according to the World Health Organization. So, going back to the story that I mentioned earlier, what's the cause of that? The cause of that is called Postcode Lottery. As you can imagine, the definition of this is a situation where a person's health is affected by the area of the country in which they live. Are they all the factors though? Definitely not. I cannot miss out the most glaringly obvious factor: wealth and socioeconomic status, or SES. This means that when a person is poor and has a low socioeconomic status, they have a higher risk of having poor health. There was a study led by a professor called Professor Paolo Villius, who's from the School of Public Health at Imperial College London. He took a few colleagues and they studied 1.7 million people. They used these people's job titles to estimate their socioeconomic status. They then compared the SES to the main risk factors, which are tobacco use, unhealthy diet, harmful use of alcohol, and physical inactivity. As a result of this, they found that those with a lower SES were 46% more likely to die early compared to those who had a higher socioeconomic status. So, the importance of these factors can be described using the structure of a rainbow. The red and orange bit would be general SES, living conditions, and environmental conditions. The green and yellow bit would be the second least important factor, which is the healthcare service, making the second most important factor a person's social and community networks, and the most important factor an individual's lifestyle. I'm going to end this speech with a bit of advice. No matter what your socioeconomic status is or where you live, there are 5 things that we can do to make sure that we have the chance of living the longest and healthiest life possible. These 5 things are: don't binge drink, smoke or overeat, exercise regularly, Take advantage of the education opportunities throughout the course of your life. Volunteer to help others. And maintain and build strong social networks. Don't get me wrong, we may not consistently do these 5 things throughout the course of our life. However, we should encourage ourselves and encourage those around us to do the best that we can so that we have a healthy lifestyle and live the best life that we can. We have one life and one body to look after. We must do this right before it's too late. Thank you.
Hello, today I'll be speaking about health inequalities in the UK. Health inequalities are the unjust and avoidable differences in people's health across the population and between specific population groups. Health inequalities go against the principles of social justice because they are avoidable. They do not occur randomly or by chance. Health inequalities are not the same as health inequities. The term health inequality generically refers to differences in the health of individuals or groups. In contrast, a health inequity or a health disparity is a specific type of health inequality that denotes an unjust difference in health. Health inequalities are caused by a wide range of factors. The worst health outcomes occur when people have limited access to healthcare, experience poorer quality care, and practice more risky health-related behaviours, like smoking, for example. There is ample evidence of social factors, including education, employment status, income level, gender, and ethnicity, have a marked influence on how healthy a person is. In all countries, whether low, middle, or high income, there are wide disparities in the health status of different social groups. The lower an individual's socioeconomic position, the higher their risk of poor health. Conditions that lead to marked health disparities are detrimental to all members of society. Some types of health inequalities have obvious spillover effects onto the rest of society. For example, the spread of infectious diseases, the consequences of alcohol and drug misuse, or the occurrence of violence and crime. Disparities in health are avoidable to the extent that they stem from identifiable policy options exercised by government, such as tax policy, regulations of business and labor, welfare benefits, and healthcare funding. It follows that health inequalities are, in principle, amendable to policy interventions. A government that cares about improving the health of the population ought therefore to incorporate considerations of the health impact of alternative options in its policy setting process. Public health programs that reduce health inequalities can also be cost effective. The case can be made to give priority to such programs, for example, improving access to cervical cancer screening for low-income women, and efficiency grounds. On the other hand, few programs designed to reduce health inequality have been formally evaluated using cost-effective analysis. I conclude that fairness is likely to be the most influential argument in favour of acting to reduce disparity in health, but the concept of equity is contested and susceptible to different interpretations. There is persuasive evidence for some outcomes that reducing inequalities will diminish spillover effects on the health of society at large. In principle, you would expect that differences in health status that are not biologically determined are avoidable. However, the mechanisms giving rise to inequalities are still imperfectly understood, and evidence remains to be gathered in the effectiveness of intervention to reduce such inequalities. Thank you.
Hello all. In today's world, advancements in medical technology and its better access has improved the general health of the whole population. However, inequalities still exist and not all people have equal access to it. During this speech, I would like to talk to you about the health inequalities in the UK. I'd first like to start by asking, what is health inequality? Basically, it's driven by differences in health status that are caused by inequalities in society. This is shaped by many factors, including job security, lifestyle, discrimination, physio-social stress, and many more. These differences have a huge impact because they result in people worse off, experiencing poor health and shorter lives. During the 19th century, health inequality was mostly due to factors such as overcrowding, lack of healthcare facilities, and poor sanitation. But now, due to our industrialized society, these disadvantages have mostly gone. We now have more modern hospitals, experienced doctors, and knowledgeable medical staff. But not everyone can afford treatment. Currently, in England, people living in the least deprived area of the country live around 20 years longer than people in the most deprived area. This makes sense when you regard the many advantages higher income people have, which include more knowledge about their health and more frequent visits to the doctor. Adding on to this, higher income people generally take preventive methods, like being able to take regular screening for serious illnesses and being able to take off time from work freely without worrying about bills or other day-to-day expenses. Furthermore, higher income people can also have access to the private sector of healthcare, which is certainly plays a role in health inequality. A second factor that contributes to health inequality is how minority ethnic groups generally have worse health than the average population. Evidence suggests that the poor socioeconomic position of ethnic groups is a main factor driving this. There are many ways to tackle this problem, and one way is by emphasizing the needs of Black and minority ethnic groups when creating healthcare policies. Lastly, I'd like to talk about the effect COVID has had on our already straining healthcare system. In the heat of the pandemic, many people with long-term conditions were not able to get their routine care at the hospital, and it was instead pushed back to a much later date. The consequences of this action has resulted in worsening health inequalities now and in the years to come. These are a few of the factors that contribute to health inequality. My next question is, how are we going to catalyse change? I'd like to suggest some ways. We firstly should start by providing children a good early start in life. And we can do this by giving them good quality primary education and childcare. This will give children more knowledge about their health and also help give them advice for future things like work and jobs. Secondly, we need to create a healthy and sustainable place. We can do this by investing in public transport and pedestrian-friendly pavements. Thirdly, we must make an effort to tackle poverty. We can start this by encouraging unemployed people into jobs. However, these jobs must offer a minimum level of quality, like flexible hours or a decent wage, as this will help people balance a work and social life, which will hopefully reduce work-related and financial stress. I personally think that poverty and the limited funding of NHS services have the biggest cause for widening the gap in health. The NHS regularly comes in the top 5 worldwide for the most equal healthcare system, but there are still some cracks in the system. We must fix these, as healthcare is a basic human right and everyone deserves good care without any biases. Thank you.